Speaking of weather and sun and all that's going on, we are in monsoon season, but all you have to do is step outside to know the temperatures are still not going down. It is steamy and muggy. And as with every year, the dry, high heat is claiming lives. In Maricopa County alone, we have learned there have been 16 confirmed heat-related deaths this year. Many, many more deaths are under investigation, likely related to the heat. Dr. Hannah Schroeder from SCNM Medical Center joining us to help us understand heat exhaustion and how to know when somebody is really at risk. So good morning. Thank you so much. It is incredibly important. What are the signs that we need to be on the lookout for?
Good morning. Thank you for having me on. So, some signs that are important to look out for include dizziness, headache, nausea and vomiting, muscle cramping, feeling tired or weak, feeling like you're going to faint or pass out or passing out, confusion, fast and weak pulse, and even skin changes can happen. You can get cold, pale, clammy skin, and you can also get very hot, dry skin. So, those are some things to watch out for and some warning signs that maybe you've been in the sun too much and now it's time to seek medical attention.
What's the difference between heat exhaustion and heat stroke?
That's a great question. A lot of the symptoms are very similar, so it's kind of a progression, to be honest. First, you might start with heat exhaustion, where you're feeling more tired, you have a headache, experience some nausea and vomiting, you have some dizziness, and it can progress to full-on heat stroke, where you might pass out or be confused. And that's a medical emergency.
So at what point do we, if we're assessing somebody else, say, and seeing that they're showing some signs of this and really kind of succumbing to the heat in some way, at what point is it enough to just get them into the cooler air and hydrate them? And at what point do you think we need to dial 911?
I mean, at the first signs that something is wrong, say like a headache, dizziness, nausea, or vomiting, I would move the person into the cool air. Signs of confusion, dizziness, fainting are kind of emergency symptoms, and that's when I would call 911.
What can we do to, besides the fact that, we know that we have to hydrate ahead of time, I suppose, and think carefully about what time we're spending in the sun. If we have to be outside or will be outside, what else can we do to better protect ourselves so that we don't, suffer this heat exhaustion?
Absolutely. That's a great question. At the SCNM Medical Center, where I work, as you can imagine, we see an increase in heat-related illnesses during the summer months. And some preventative measures that I tell my patients to take are, for one, we all know, stay hydrated, of course, is extremely crucial, extremely important. Staying hydrated helps your body to sweat and maintain a normal temperature. And sweating, as uncomfortable as it may be sometimes, it's actually very important for your body to be able to cool itself down. Another point is to wear appropriate clothing. You don't want to wear too many clothes or too many layers or even clothing that fits tightly because this prevents your body from cooling down properly and regulating its body temperature. You're not getting enough airflow to the body. Wearing sunscreen, of course, is always crucial and can help prevent heat exhaustion and heat stroke. So sunburn can also affect your body's ability to cool itself down and to maintain body temperature. So it's important to use sunscreen and even like clothing like hats that can prevent sunburns.
Big difference. Definitely that protection is crucial. Dr. Schroeder, thank you so much for your time and for this important information. Let's try to keep our viewers safe.
Thank you.